Welcome to this explainer. Today, we're diving straight into the neck. It's the body's most densely packed, incredibly busy, and vital transit corridor. Think about it. Every single signal connecting your brain to the rest of your body and every drop of blood feeding your brain has to pass through this narrow, flexible cylinder. It is literally a masterclass in biological packaging. Today, we're going to decode this 3D puzzle together.
Here's how we're going to map out our journey. We'll start by mapping the neck triangles, then look at the essential bones and muscles, trace the nerves of the neck, cruise down the vascular highway, and finally, dig into the deep structures and glands. Let's get right into it.
Section 1. Mapping the neck triangles. First up, we need to map the territory. The neck is essentially divided into a posterior and an anterior triangle. And the main landmark doing this dividing, it's that large diagonal muscle called the sternocleidomastoid. It's that thick muscle you can actually feel when you turn your head side to side. So everything in front of it is the anterior triangle, ending right at the midline of your throat. And everything behind it, bounded by the trapezius muscle at your shoulder, well, that's the posterior triangle. This simple two-part roadmap is exactly how surgeons know where to find specific vital vessels and nerves.
Moving on to Section 2. Essential bones and muscles.
Let's peel back that top layer. What's absolutely fascinating here is how neatly these cervical muscles are organized into highly coordinated teams. Right in the middle of your neck floats this little U-shaped bone called the hyoid bone. We've got the suprahyoid muscles above it and the infrahyoid muscles below it. When you swallow, the suprahyoid team fires off, pulling the hyoid bone and your airway up and forward. Then, the second the food passes, the infrahyoid team immediately contracts to pull the whole setup back down. It's like a perfectly choreographed constant tug-of-war happening dozens of times an hour, and you don't even have to think about it.
But what happens when this delicate muscular balance gets thrown off? Well, the structural integrity of the entire neck is compromised. Say a major muscle, like that sternocleidomastoid we just talked about, gets injured, maybe during a difficult birth. It can actually become fibrosed, and because it can't lengthen properly as the neck grows, it literally pulls the head into a severe, twisting muscular imbalance known as torticollis or Reinach. The chin ends up pointing upward and towards the opposite side of the injury. It's a tough condition that usually requires intensive physical therapy or even surgery to fix.
All right, Section 3. Nerves of the neck.
Going a bit deeper, we hit the complex electrical wiring that powers the whole operation. When we consider the major nerve branches, the cervical plexus is absolutely vital. Just think about the phrenic nerve for a second. This specific nerve, which originates mostly from the C4 spinal level, travels straight down through the neck to provide the only motor supply to your diaphragm. It is, quite literally, the electrical cable that keeps your diaphragm pumping so you can breathe. Pretty crucial, right?
We've also got the accessory nerve navigating this dense neighborhood. And this is a perfect example of anatomy in real-world application. If this nerve gets severed or damaged, say during a biopsy in that posterior triangle we mapped out earlier, it completely denervates the trapezius muscle. The clinical result? The muscle wastes away, resulting in a very visible, downward drooping of the patient's shoulder. Just like that, snipping one wire takes out a major muscle group.
Before we wrap up the nervous system, we absolutely have to talk about the brachial plexus. These are massive, thick bundles of nerve roots coming from the lower neck, passing right between the scalene muscles. But they don't stay in the neck. They travel all the way down to completely supply the arm and hand.
The reality here is that because the neck is so incredibly mobile, these nerves are actually super vulnerable. If there's a violent separation of the head from the shoulder, like, say, in a bad motorcycle crash, or from excessive stretching during a really difficult childbirth, the upper trunk of this brachial plexus can literally tear. This paralyzes the lateral rotators of the arm, creating a very specific inward rotation of the limb. Clinically, this is known as waiter's tip hand or birth palsy.
Section 4. The vascular highway.
Now this is where the engineering of the neck truly becomes high stakes. Your brain demands a massive, uninterrupted flow of oxygen, and it all has to travel through here. The vascular network is incredibly dense. The veins and arteries are packed incredibly tight, woven right alongside the nerves and muscles we just went over. You have the massive internal jugular vein bringing all that depleted blood down, and the powerful carotid arteries pushing oxygen-rich blood straight up. It's a crowded, high-pressure environment.
Here is a totally fascinating piece of medical trivia for you. There's this stark asymmetry in how the major carotid arteries actually originate from the heart. You'd think human anatomy would be perfectly symmetrical, right? Well, it's really not. The right common carotid artery branches off a shared pathway called the brachiocephalic trunk. But the left common carotid, it sprouts directly off the aortic arch itself.
Now, running laterally at the very base of the neck is the subclavian artery. Think of this as a major transit hub. Before it even gets to the arm, it sends vital branches upward. The most critical of these is the vertebral artery, which literally threads its way up through the tiny bony holes in your cervical spine to directly supply the brainstem.
But what happens if that main subclavian highway gets blocked by disease before the vertebral artery branches off? Well, physics takes over. The arm still desperately demands blood, so it literally steals it. Blood that was supposed to flow up to the brain actually reverses direction, flows back down the vertebral artery and into the arm. This is called subclavian steal syndrome. When a patient exercises their arm, it drains the brainstem of oxygen, causing acute dizziness, vertigo, and even fainting.
Understanding this 3D vascular geography isn't just for passing anatomy exams. It's precisely how clinicians safely pull off everyday critical procedures. Let's say a doctor needs to place a central venous line directly into the heart's superior vena cava to deliver life-saving meds. To do it safely, they have to find the exact apex of the triangular interval between the clavicle and our old friend, the sternocleidomastoid muscle. From there, they guide the needle right into the internal jugular vein, perfectly avoiding the lung and the major arteries hiding just millimeters away.
Finally, Section 5, Deep Structures and Glands.
Before we look at the exact placement of these deep organs, we really have to ask what happens when the neck's master metabolic regulator, the thyroid gland, goes completely haywire. It's not just a chemical issue. Because of the incredibly tight spaces in the neck, it quickly becomes a major mechanical, physical problem too.
Anchoring our deep anatomy here is the thyroid gland. It's that butterfly-shaped organ wrapping directly around the front of the trachea, heavily supplied by the superior and inferior thyroid arteries we mapped out earlier. It sits right on top of your airway, right in the thick of it all.
Because it occupies such prime real estate, things get complicated when the thyroid malfunctions. Whether it's an autoimmune condition like Graves' disease where it overproduces hormones, or Hashimoto's disease where it's destroyed and underproduces, the gland can physically swell into what is called a goiter. And because the neck is already packed to the brim, this swollen goiter literally has nowhere to go but inward. It physically compresses the nearby trachea and the esophagus right behind it, which can cause severe difficulties with breathing and swallowing.
So, if a surgeon goes in to remove that diseased thyroid, they are walking into a microscopic minefield. Tucked right behind the thyroid sheath are the parathyroid glands. Sometimes these are just 4 tiny ovoid bodies about the size of a grain of rice, but they control all the calcium in your body. If a surgeon accidentally removes them during a thyroidectomy, it causes an immediate and dangerous crash in blood calcium levels. This leads to severe, potentially lethal muscle spasms known as tetany.
So, as we wrap up this explainer, consider this final scenario. A patient is choking, their airway is totally blocked, and seconds count. When an emergency physician performs a life-saving cricothyrotomy, slicing through the skin to insert an emergency air tube, how does mastering this densely layered spatial journey we just took prevent a fatal surgical mistake? Well, if they forget about the anterior jugular veins near the midline or miss the exact thyroid placement, a life-saving procedure could easily turn into a fatal hemorrhage. Understanding the anatomy of the neck isn't just about rote memorization, it is the ultimate roadmap to saving a life. I really hope you found this breakdown as fascinating as I do. Keep exploring, and we'll catch you on the next explainer.